Hello, Mr. Mackay.
Hello.
Thank you so much for allowing me to record you. So guys, we have reached the end of quite a elaborate rehabilitation. Do you remember those very first symptoms you've had we talked about? You know, why you actually wanted to invest, and you've heard about my work. So what were the main concerns at the time?
It was at the same time I was visiting an osteopath for my back,
Yes.
and he's a peculiar way he operates, and he detected that I had problems from my back stemming from my teeth, and he pointed to two particular teeth, and he said that energetically, in terms of Chinese meridians, they
Yes.
were linked, and the problems in my digestion, my hip, and my back all stemmed originally from my teeth.
And I do really agree. Rafilko, can you turn off the sound? Because body will prioritize breathing. When we do need to lean forward to breathe more effectively, it will have an impact on the whole skeleton, all the way down. If we do lose few more teeth on one side, the pressure on the TMJ will be more on that side, so you're going to tilt your head away from it. Then the shoulder goes up, then the hip goes up. And if we function with that for many years, there is a pressure in that hip, there is a problem in the knee, and I think this is what has reached you. Hence you had to see the osteopath to get muscular releases, but he very smart person, knew where the trigger really was. So what we have done, we have used the protocol to recreate the tissue loss, because all the teeth, they were quite worn, loads of edges were chipped, there are a lot of teeth missing. And we have used the protocol to bring the jaw forward and down within a muscular acceptance, the 66. First, we have deprogrammed our patient. We've used the Lucia J because the muscles were very spasmatic. I think the whole body was very tense. There is still a bit of that, however, I think it's much less tense. And after the whole journey, I know you've had some more physio treatment to help with readjusting the whole changes along the skeleton, because it's a big shift from...
At the time,
Tell us about this.
because I also have TMJ
Yes.
in both jaw joints, but particularly bad in the right side. All my problems were on my right hand side.
Right.
So I had my hip changed on my right hand side.
Yes.
The back pain is on my right hand side.
Yep.
The TMJs were on my right hand side.
And I think this is also where more teeth were gone. That's right. So how is it now after...
I'm finding that I've got considerably less back pain.
Fantastic.
My digestion has calmed down. I don't have as much reflux as I used to get. And I got less TMJ ringing, tinnitus. In this year. There's still some in this year, but it's early days yet.
Amazing.
And I am finding I don't snore as much.
Excellent.
Which is good news for my wife.
Fantastic. Do you remember exactly when we finished? Because it's been quite a few months, hasn't it?
I'm sorry, I don't know. It was one,
I think it might be even...
I think it was June.
May. Yes, so it is good 4 months after the completion of the journey. The work actually, guys, doesn't take so long, because we do preps of the teeth, and all of the buildup is done outside of the patient mind in the lab. We implement all the overlays and crowns, and then we build up the fronts with composites. And after that, we have done dual chrome dentures for our patient. And yes, but I really would like to mention that extra kind of journey you made to another physiotherapist. It was a different gentleman to the one that referred you initially.
It was, again, it's all slightly alternative.
Yes.
And again, he picked out that the problem stemmed from the teeth.
Yes.
And that the body was beginning to realign.
Yes.
I mean, when I had my hip changed, that was about 6 years ago now, they put the leg back on straight.
Yes.
But it took my body 6 months to realign from the pain of straightening my leg out. So I think it's going to take 4 or 5 months at least after all the dental work that you've done.
Yes, because
For
we
the
are
body-
we are there actually. It is
for the
4 or
body
5.
to fully recompensate back to how it should be.
Fabulous. It's wonderful to hear you have less pain, less digestion problem. Are your TMJs more how are they doing?
Better in one ear, still a little bit there in the other, but they're better.
They are better overall. Fantastic. Thank you so much for this feedback and thank you for your little present. Very nice. Thank you.